Dr. Deepti Shah is
We'll need to make Simran co-host for the first segment.
So Shreya, Simran,
Admin.
sorry. Admin is co-host, okay. And then
That's
Sheetal
it.
is co-host. So I think yes, the panel is complete. Yes, we can start now. Full screen, please.
Yes, sir.
Thank you all of you. Welcome again to this 258th edition of Thursday Musings. This is a sort of follow-up session for a previous session that we had. We'll be talking about SLDs and what to do after you diagnose them. So the meeting is being recorded. This recording will be available on the our YouTube channel. The questions are invited in the chat box. So you can type the questions in the chat box. They will put to the resource persons. And everyone will be on the mute mode because usually we have large number of participants. So welcome all of you. Next slide, please. I'm handing over the session to Professor Dr. Tufan Pati, sir. He is the chairman of this program. Over to you, sir. Take over, please.
Thank you, Dr. Alim, and welcome all the participants to this edition of Thursday Musings. Next slide, please. I welcome and I appreciate the contribution of all the moderators, Dr. Alim Siddiqui, Dr. Amrit Patajoshi, Dr. Shobit Garg, and Dr. Vishal Chhabra. I know today there is Sipkan is there, and in Vrindavan, everyone must be on the way to Vrindavan or in Vrindavan. And next slide, please. I'm very happy to introduce Dr. Alka Subramaniam. She is Associate Professor of TNMC and VIL Nair Chandra Hospital, Mumbai. Laurels and Training awarded the Har Gobind Fellowship in 2007. Went to State University of New York for experience in child psychiatry. Pioneered the establishment of a Learning Disability Clinic, Autism Center and Remedial Center at Nair Hospital. Also pioneered the establishment of the Psychogeriatric Clinic at Nair Hospital. She has 18 years of experience, number of awards, numerous awards at national and state level, more than 20 as represented in country in SARC in 2006. Number of publications in index journals, more than 80. Other special positions held: IPS co-chairperson of Young Psychiatrists 2006 to 2008, Disability Expert 2018 till date, IACM EC member 2010 to 12, IAGMA secretary 2012 to 14, awards chairperson 2016 till date. Welcome, Alka. Next slide, please.
Thank you so much, sir.
Dr. Deepti Shah is our other chairperson. She's consultant psychiatrist and counselor since 25 years with special interest in child psychiatry and women mental health. Awards and honors: Times Healthcare Achievement Award for exemplary work in psychiatry, Kutch Ratna Award for community service, gold medal in MD Psychological Medicine of Mumbai University, Head Shilova Center for Autism, authored books for public awareness on mental health and schizophrenia, depression, panic disorder, psychosomatic illness and stress management. Conducted more than 500 workshops in women's mental health, second innings of life, stress management, positive parenting, adolescence, etc. Welcome, Dr. Deepti. With this, I hand over the meeting to the chairpersons, Dr. Deepti Shah and Dr. Alka Subramaniam. Please take over and introduce our faculties and carry on proceedings. Over to Dr. Alka and Dr. Deepti. Someone has to introduce the topic also.
Deepti, you're on mute. You're not able to unmute?
Yeah. Now I can. Now I have been able to. Yeah. Good evening, everybody. Thank you, Team Musings, for inviting me today for this session. I think you guys are doing a wonderful job over so many weeks, so many months, and so many years. As you all are aware, that Maharashtra has been one of the pioneer states in getting concessions for students with specific learning disabilities way back in 1996. The Maharashtra Dyslexia Association, along with our own stalwarts like Dr. Kirsi Chawda, Dr. Harish Shetty, they all worked hard towards getting certification for specific learning disabilities. And San Hospital, which is my and Alka's alma mater, we were the first center in Maharashtra to certify LD. And of course, now Nair is one of the pioneer centers for LD, which Alka heads. So, and this team today, I think, is a wonderful team with a lot of experience. So we will get very practical tips from them. As we understand, diagnosing specific learning disability is probably the first step. And then that's when the journey begins, right? From providing the various learning skills to the students, empowering them, building their self-esteem, and definitely working towards inclusion. So I think this panel today is going to help us understand that much better. And I now request Alka to introduce the speakers and give us some idea about the Nair LD Clinic.
Thank you, Dipti. And at the outset, thank you, Tofan sir and Alim, for having us here today and for that kind introduction. Actually, Dipti and me are batchmates, but as you know, she is more tech savvy and has an advanced slide, and mine is an older slide, which was shown as you could see it. But anyways, we go back a long way. And she runs a private center which does similar testing in Mumbai since the same amount of time that we do. So last time when we had the session in Thursday Musings, I don't remember the exact number, but it was 200 something, and now we're on the 258th session, which is wonderful. A round of applause for Thursday Musings. Coming back to that, we had discussed about diagnosis of LD and how to go about it as if you have a multidisciplinary team or if you have an individual setup. But that seemed a little incomplete with the feedback that we got. And Alim was like, what do we do after we diagnose LD? What do we do for the kids and how do we really approach it? So Simran, who is our special educator, and Sheetal, who's our head clinical psychologist, has been with us at Topiwala National Medical College and Nair Hospital since almost 2 decades, 19 years to be precise, since the inception of our clinic. And both of them have really evolved in understanding LD. And I don't think that today there's anybody better who could have walked you through this process of what is remediation and what happens to the child when we intervene, which is why we thought it's so important to bring it forward. Now, obviously, we cannot really abridge a whole course because this is like an MD and entire psychology course in the span of 1 hour. So what we have tried to do is give you glimpses of exactly what the remedy, and also to try and give you a few examples of how that works out and pepper it with. So I actually had told Alim that I'm going to be more of a moderator than a chairperson because I will pitch in the middle whenever we think you want to understand a concept. And you can sit back and really enjoy what they have to show you and the wealth of experience they have and get ready with your questions at the end. So without wasting further time, I will request Simran, who also, I must tell you that it is thanks to largely their effort that we started the offshoot of our LD center, which is the Vivekanand Remedial Center, where we have remediation going on for underprivileged children, largely who cannot afford it, because one session in Mumbai costs 1,000 rupees plus at a basal rate per 45 minutes maybe. So they both are affiliated to that also. So that adds to the experience that they have. Yes, Simran, welcome, and the field is all yours.
Thank you so much, Pam. And thank you for giving us this opportunity to be a part of this session. Okay, I'm going to try and you'll have to just tell me whether it's getting shared or not. That's all.
Not yet. Should we ask for them to display it?
Yeah. Is it now getting shared?
Not yet.
Not yet. Okay, I think let them display it then, because then this is not looking.
Priya, do you have the backup?
So should I share now?
Yes, please.
I hope it is there.
Yes, that's right.
So, full screen now.
Thank you. All right. So I'll be talking about remediation today, and let's see what we have in store today. So we have remediation in a nutshell, right? Remediation for the pre-primary levels, remediation for the primary levels. Then what would remediation look like for the secondary levels? How do we decide which level the child would be in? And then we'll have a couple of case studies to understand this a little better. Right. So let's go to the first the thing, remediation in a nutshell. Yeah. All right. Now, when I say the word remediation, if you can just in 15 seconds on the chat, if you can just tell me what comes to your mind in remediation, whatever word comes to your mind. So you can start typing just whatever word comes to your mind. Great. Turn around, substitute. Giving a solution. Mediate, bridge the gap. Special attention, care. Great. All right. Can you just tap the screen, tap it once? The slide? Yeah. So even me, that's great. That's great. Intervention, great. Bridging the gaps. So that's great. So even for me, what I have put over here is that remediation is a process, right? Somebody else has an individual plan over there written. So it's a process, yes. It targets learning areas and it affects the reading, writing, maths, thinking skills of the student. And very, very important, it is child-centric. Right, that's what differentiates it from other processes also, that it is a very child-centric process. So let's see what remediation is then. Just can we have the next slide, please? So remediation, like we said, right, is a process that helps the student to acquire his age-appropriate skills in all the learning areas or the foundation areas, and hence the child is able to accomplish attaining knowledge. Like I said, child-centric at his or her own pace and potential. So that's what remediation is in a nutshell, right? So let's look at the next one now, right? So remediation for a pre-primary level, right? I am not putting it as a pre-primary child because students, when they come to us at various ages. So I'm putting it as at levels right now, right? So remediation for the pre-primary level, if the child is coming to us and we have noted he's at a pre-primary level, what would it entail? Obviously, pre-reading skills, the pre-writing skills, oral language skills, and the pre-math skills, right? Okay, for the next slide, please. So what would come in the pre-reading skills, right? Identifying different sounds. So basically, we are playing with sounds over here. So the child is now getting a little bit more aware of how sounds are different, right? So same and different sounds and sequencing of sounds, right? Now, when I say identifying different sounds, it could be, this is just a little bit pre-phonetic, right? So I could go, right? What sound is that? Sound of a, you can type again, no problem. All right, so that was a sound of a clap, right? Okay, and suppose I give you this sound. What do you think that is the sound of? If you could just type in the group also on the chat. Okay. All right. So basically, I was using my glass, right? I was using the glass and a fork, and I was making that sound. Okay. So basically, a different sound, right? And what sound would this be? Well, saw the photograph also. So that would be of snapping, right? Now, if I ask you, so that's how we are identifying different sounds, right? Sequencing of sounds, obviously, going 1, 2, 3. What was the first, second, and third sound? All right. Can we have the next slide, please? So one is your auditory perception. So the child is now getting aware of sounds, right? And then we come to the phonics, right? In phonics, when I'm talking about phonics, I'm talking about alphabets, right? So naming the alphabets, the sound symbol association, that is the sound that the alphabet makes. Example, B says B, C says K, right? Apart from that, starting and ending sounds, right? Word or sound deletion. Again, I would like you to answer in the chat. Okay, as much as possible, please do answer in the chat. We'll try and make this a little more interactive. So word deletion. Now, what do I mean by word deletion? So in the word popcorn, if I take away pop, what do I get? Corn. Very good. In the word catch, if I take away C or the K sound, what do I get? Atch. Amazing. Great. So that's called word or sound deletion. The first example, obviously, word deletion and sound deletion, right? So this will come under phonics, and then it helps the student to, again, here we are working with sounds, right? Playing of sounds. All right. Can we have the next slide, please? You'll have to probably tap again. Yeah, okay. So we have here now, for example, another example is a short vowel sound. So when we are dealing with sounds, we deal with consonants and vowels. You'll have to keep tapping. I think there are 4 or 5 taps out here, right? So apple, A. Tap again, please. Yeah. Egg, Eh. Right, so A, E. Igloo, I. Orange, O. And umbrella, right? So these are the sounds of the short vowel sounds. So this is what your phonics would look like when I'm talking about sound symbol associations and, playing with the sounds. All right, next slide, please. Right, we also work with the multi-sensory approach over here. So, so when we are talking about the sound and the symbol, right, the student can make the symbol with clay, like you see on the picture on the right. We have cutouts which are made of sandpaper. So the child can feel the alphabet also. So he feels the alphabet, he says the name of the alphabet, and he says the sound of the alphabet, right? Students who get confused with B and D, reversals, right? So B and D, this is another thing that we can do, right? We make the bed. So when you make the bed, right? Bed cannot be made this way because bed starts with B. So this is your B, this is your D. When you join B and D, you get bed, right? So again, found that this helps a lot of students out when they get confused with B and D, which side to put it. I also normally just tell them, okay, make your bed. Come on, which one? Right? So they automatically come to know which is the B and then which is the D. Okay. So that's the multi-sensory approach, VAKT that we say, visual, auditory, kinesthetic, and tactile. So we try and use as many of the senses as possible, right? Even when we're teaching phonics. All right, next slide, please. Right. So we did sound deletion. This is now sound addition. So if you add pet after car, what do you get? You can write your answers down on the chat. Carpet, very good. If you add the sound to lat, what word would you get? Flat. Very good. So this is sound addition, right? Sound substitution, right? So If the word is rainfall and you substitute rain with snow, what would you get? What was the new word? Snowfall. Very good, right? Similarly, so this was for word substitution. Similarly, for sound substitution, in the word tan, if you replace t with p, what is the new word? Pan, right? So this is sound substitution, which helps with students when they are doing then rhyming words. Okay. Then we have joining sounds. So we start with joining of two sounds together. Then we go on to CVC words, that's consonant, vowel, consonant, and we go on to then the blends. Yeah, can we go to the next slide, please? Right, so those were your pre-reading skills, where a very heavy focus is on the phonic sounds and playing with the phonic sounds. Right. Apart from that, we go to the pre-writing skills, where you will find fine motor skills, you will have eye-hand coordination, right? And you'll have your visual perception, which is very important again for writing. So this is, we are talking about the pre-writing skills, since we are talking about the pre-primary level. Okay. So we have, like you all must be also knowing about bead sorting and stringing and clay modeling, like we showed in the earlier slide. Paper tearing, that's tearing paper with your fingers, again, very good for the fingers. Paper crumpling, right? You take paper and you take small sheets of paper, right? And you crumple them together, so you get small balls. And with these activities like paper tearing and crumpling, you know, we make them stick it on a particular shape or something, so they get a nice something to take back also, right? And sticking, again, very good for fine motor skills. Can we go to the next slide, please? Eye-hand coordination, again, very important for pre-writing. So scribbling, coloring, joining dots, mazes, paper mosaics, right? Yeah, next slide, please. The visual perception, right? So, for example, identifying same and different objects or pictures, right? That's at the basic level. There's pattern drawing, right? Very important also for handwriting. So when they have the pattern drawing, and that is the base for your handwriting, right? Find the object from a nice picture of which is full of objects. To find the objects, you have puzzles, you have memory games, right? Visual memory games for visual memory. You know, find the missing part from a particular picture. So these are all basically activities of visual perception. Right. Okay. This is just an example of what pattern drawing looks like. Right. So your mountains and all help in your alphabets, which have got slanting lines. Right. You have standing lines, sleeping lines. You have the U that jumps, the U's, the M's. Right. So this all helps them in then making their alphabets. Again, pre-primary level, even if a student is of an older age, but has come in the pre-primary level, I can give him these activities to do so that it improves his handwriting and overall visual perception. All right, next slide, please. Right, next is the oral language skill. Right, very again, quite important, because if you talk correctly, then you tend to write correctly. Right, so we work a lot with the oral language skills also. The type of activities which are there are your object talk, that is on a particular object. You tend to tell the child to talk about the object, right? So what is this? What do we do with this? Right? We go ahead with those things. Picture talk, obviously you give a picture. Experiential learning is, you know, we tend to talk to the child about how was your day? You know, so whatever he's experienced in his day, he tends to talk about that. So that can happen. Translation. So another thing which sometimes I have found good with students, you say a sentence in Hindi and you tell them to translate it into English, right? Obviously, this is not for students which at a lower age. This is oral language skill, but maybe a primary student who is at a pre-primary level, right? Understanding directions. So directing, you can even have a picture over here, right? And then according to the picture, you tell the child to point at different things. So that is there. And conversations, obviously, with students. Again, this can happen at any age, right? It's just helping with the oral language skill. Also, sometimes in older students, it helps them to express their feelings, Yeah, the next slide, please. Right, pre-math skills. So stuff like sequencing, sorting things, classifying, right? So classifying you can have different pictures of different shapes and tell them to, so I can have a pencil box, a dining table, and tell them what shape would it come into, right? So just basically classifying that, patterns, understanding patterns, what comes next, and obviously counting, that would be your pre-math skills, some of the activities in the pre-math skill. Yeah, next slide, please. Right, concepts of topics like big and small, more or less, right? Number recognition. After all the earlier things are done, then we can come to number recognition, number value, and the 2D shapes. Next slide, please. Right, so that was like how a pre-primary level would look like. What are the activities that would go into a pre-primary level for remediation, right? If the student has been diagnosed and is coming in the primary level, right? In the primary level under reading, obviously phonics continues, right? We have different spelling rules which would come into play also, right? Syllabification, where you're breaking up the word. For example, if I give you the word table, how many syllables would this have? Again, if you can just give me your answers in chat. The word is table. Absolutely, two. Table, right? So it's basically how we are saying it. Also, you can make out the cuts that are there in the word, right? Otherwise, syllabification also has quite a few rules to it. So obviously, we're not going to get into that, but just to make you understand, right? Butter. How many syllables in the word butter? Two, correct. Absolutely right. All right. One last word. Condensation. How many syllables in the word condensation? If you say it, you will understand where the breaks are. Absolutely right. 4 syllables over there, right? So this is syllabification. It helps to break the word and then spell each syllable, right? So you're teaching the child over here, not only reading, but also parts of the spelling. Okay. Yeah, can we go to the next slide, please? Right. Yeah, just tap 3 times more. Thank you. So these are just examples of some spelling rules that we get into when we are teaching remediation, when we're remediating spellings. Yeah. Right. I before E, except after C, when I jumps over E. So don't get deceived. Okay. So this is just an example of one of the rules. And the next example is also there. Yeah. Next slide, please. Right. Apart from that, in reading, we have word reading, paragraph reading, right? Vocabulary building activities. So we help them to work with antonyms, synonyms, homophones, right? Under grammar, we normally start with small topics like parts of speech, right? So we have small grammar topics which come into the primary level also. Grammar being important, so that sentence structure then becomes simpler for them to understand. All right, the next slide, please. Right, so after reading, we come to comprehension. Comprehension is of 3 types normally. Your literal comprehension, inferential, and critical. Literal is like your who and, you know, where, simple wale questions, right? Inferential is a little bit of thinking, and critical is at a much higher level, where you can ask students like, okay, if you were in that place, what would your response be? So right at the critical level of thinking. For this, we have different types of activities again, where you have picture comprehension, that is the basic level really, where you have a picture and you're asking students to answer questions based on pictures. So good for literal level, the literal level of comprehension, right? Listening comprehension, where, students are having problems with reading, then they get into listening comprehension. And reading comprehension, where the student now is reading on his own. So depending on where the student lies for comprehension, we can go ahead with this. Yeah, can we go to the next slide, please? This is just one of the strategies of comprehension that, how to do comprehension is what we also then need to teach, right? Students don't understand how to do it. So I can tell the child, okay, this is your paragraph, now comprehend. But how do you do comprehension is also what we teach. So Rumrajas being one of the strategies of comprehension, read the passage, underline the difficult words, find the meanings of those words. Now read the passage and answer questions. All right, next slide, please. Then we have the writing, right? Writing skills where pattern drawings can come back in case the student is in the 6 years or 7 years of age. We can do pattern drawing again. We have study skills for writing also, like mind mapping or flow diagrams, right? Sensorial writing, sentence starters, picture stories, right? So these are just some of the activities that we can do in writing, right? Grammar and punctuation coming here again. All right, next slide, please. This is just an example of a picture story, right? Where the student can now describe what's happening in each picture, even if it is in one sentence. Yeah, next slide, please. Right, this is basically grammar. We talked about parts of speech, one of them being the nouns, right? So here again, I have used mnemonics. So POPAT is what I use for teaching students nouns. So person, place, animal, thing. It just helps the students. So whenever I say nouns, the child says, POPAT, person, place, animal, thing. So it just like comes out and he's able to then identify nouns in sentences and paragraphs much easier. Yeah, next slide, please. Right, this is again another topic of grammar, subject, predicate. Right, here I've used the flow diagram to explain what it is. Yeah, next slide, please. Right, and in the end, we come to the math, where math computation skills becoming very important at this age of primary. Place values, directionalities, story problems, and some conceptual maths that is there in their curriculum. Right, so once the top part is done, like computation, place values, they understand these things, then we can go ahead with conceptual maths also. All right, next slide, please. Now, just to make you just a little clarity on, so when we're doing maths, we always progress from concrete to abstract, right? So when we do maths remediation, concrete, so the actual objects are taken, then we go into the graphical representations, and then we can actually give the numbers and tell them to do the same. All right, next slide, please. Right, in working with addition and subtraction computation, when the students obviously at the primary levels, they're into hundreds and thousands, and so on, numbers becoming bigger. So we can actually make the columns for them, right? Let them work with columns, no problem. Even if they are at a higher age, no problem. They can continue working with columns. It just helps them to organize that matter a little better, right? Wherever graphical representations are required, like you see in subtraction, they can use graphical representations also. Okay. All right, next slide, please. Right, this is just another example how we've arranged it in the correct houses, how the student then understands how to read numbers. Okay. All right, next slide, please. When dealing with story problems, right, always important that the child understands the language of maths. So this is just an example on how we normally go ahead with doing that, where we work with the language of maths and we put the words for the student. So, when he reads the sum, he tends to, okay, fine, here sum has come, sum means I need to add, right? Difference means I need to subtract, right? So, and multiplication, division accordingly. All right, next slide, please. All right, now, so that was for primary level, right? Different activities, what we tend to do in different areas. In secondary, I have just put everything together. So we continue working with spelling rules, right? The tougher spelling rules over here also. Comprehension skills obviously are, but at a more inferential and critical level. Vocabulary building, we tend to do some paraphrasing, where again, paragraphs are given, and we tend to underline words and tell the child to keep using different words. Summaries is also what we use when the child comes at the secondary level. Grammar, we focus a little bit on grammar in basically for sentence structure. We use a lot of study skill strategies when we come to students, when students come in the secondary level to us, right? And maths since the primary level is cleared, the secondary level is more focused on conceptual maths. All right, next slide, please. This is just an example of mind mapping, right? Where I have used a slide where how to mind map. So here is just an idea of how you mind map a particular topic. Can be used for written expression, right? It can also be used when students need to learn things up, right? Learning needs to happen. So I can write my topic in the middle. So suppose I need to learn about pollution for my chapter. I write my topic of pollution in the middle, and I tend to write my sub branches become the topics under pollution. So definition, types of pollution, so all those things will come around them. So this is just mind mapping, which helps in answering questions also, and obviously in written expression also. All right, next, please. Okay, so in maths, so that was for writing and study. In maths, the 5 golden rules again has helped a lot of my students out, where I put this rule up before starting the session, right? And they've already obviously been introduced to the rule. So read the word problem, underline the key words in the word problem, put the correct sign, or write the correct formula, what you think will work, or if a diagram is required, then they draw the diagram. Now you start working with your sum. So write your statement down and then do the calculation. So then the calculation becomes the sum becomes simpler because you've already written what formula you need to use. You've already drawn the diagram. So, the understanding becomes better. So if they follow the 5 golden rules when they're doing word problems in maths, it helps them to visualize the problem, and hence they're able to do it. And it's in front of them. Right. So this has helped a lot of my students out also when they are doing story problems in maths, whether in the secondary, I put this in the secondary, but this could come in the primary level also, where they're putting the correct sign. Right. They don't really need formulas too much in the primary, but signs are important. So once they read the problem, they underline the keywords, think about which sign they have to put that sign down, and now work the problem out. Okay. So this is especially for maths. All right. The next slide, please. All right, the process now. What is the process for finding out what level to do? Obviously, you have your formal testing. You have the results of formal testing. The special educator does her informal testing a little bit more in details, right? According to that, analysis of this first part helps me to choose where, as in that helps me to get which levels the child is at. Okay, and then accordingly, we make the IEP. All right, the next slide, please. So case study 1, again, answers can come into the chat, please. Okay. Case study 1, Ravi is 10 years old. He's a boy studying in ABC school. He's in class 5. He has been diagnosed as having specific learning disability, right? They've been advised for remediation. So they come to the remedial center and meet Miss Priya. So let's help Miss Priya to understand the levels. I think, yeah. Next slide, please. Now here, each level, each area that is reading, writing, maths has followed the same process that we talked about, right? The formal testing is done. Now, according to the formal testing, next slide, please. Yeah, so according to the formal testing, the word reading age is 6 years. Now, 6 years is actually primary, but it's at the starting of primary, right? So here I can actually do I can start with the pre-primary level of remediation that we talked about, and then decide what activities I need to use, right? Comprehension age is 4 years. 4 years pre-primary comprehension. So over here, a lot of oral language usage would be used. Spelling age is 5 years. We go according to what the phonics we have for pre-primary, and written expression is 4 years. Now, this is what the testing has given us. According to this testing, I've got the different levels. Now, according to the different levels, I work with the remedial strategies that we have just seen earlier. Okay, so this helps me. My informal and formal testing will help me to decide what level my child is at, even though the student is 10 years old, right? But that's why we talked about levels. I'm not talking about, the child per se. I'm talking about what level of understanding he is at. And hence my IEP will be made according to this and according to the activities that are there. All right. I think my time is also up. So any questions?
You can
Or-
go ahead. If you want. You can do the case studies. It's all right.
All right. So Sunita is a 15-year-old girl, right? And she is studying in XYZ school. She's in class 10. Now, she's been diagnosed as having special learning disability, specific learning disability. They've been advised to go for remediation. She contacts Ms. Shreya now, who's a special educator. Can we have the next slide, please? So what we're going to do now is, the slide after this, please. All right. So I've given you all of this, right? The word reading age, the comprehension age, the spelling age, the written expression age. We already have the levels down for you also. I would like you to try and again in the chat section, can you think about what activities that you would do for student, though she's 15 years, 12 years of word reading. So what activities would you choose for her? For word reading, what activities can I give? Okay, sight word reading. Anybody else? If you remember what we did for the reading part. Word recognition games, yes. Vocabulary, yes. Crosswords. Absolutely. Story comprehensions. Paraphrasing we could try that. May not be with passages, but with sentences, we could try that. Right? Absolutely. Inferential predictions, yes. Summary, yes. So why I'm saying again, we could try paraphrasing because she is 12 years, right? That means, and age is 15, meaning she may not be very good with her vocabulary right now. So you could start with sentences and then go on to a paragraph. Right? Absolutely right. Right? What spellings or what written expressions, and how can I help her with written expressions? Since comprehension, I think somebody's already mentioned inferential, working with predictions, doing some summaries. So picture compositions, yes, absolutely. That really helps out. Sentence building with small paragraphs, yes. Sentence building activities, yes. Small paragraphs, absolutely. Absolutely. Topic writing, like planning and organizing them, right? You can use your mind mapping strategies over here. Right? You could use your flow charts over here. Absolutely. You're going on the right track. Right? And spelling, we use our different for spellings, whatever the different rules are for spellings, we can introduce the different rules. Absolutely. Story compositions, using more of adjectives in stories. Absolutely. Once she's clear about what adjectives are, right? So we can then go ahead with using them in sentences and then stories. Absolutely right. Picture sequencing, correct. So with this, I come to the end. I would try and cover whatever possible. No, to the other slide. Thank you.
Okay, so some amount of classroom experience over there. You can you can't really take the teacher out of a educator, right? Ever. So I guess thank you, Simran, for those exercises. And I think that little snapshot view of remediation made all of you realize how rigorous and intensive really the work is for a remedial educator to do interventions with these children, and just handing over the certificate is truly not enough. We really have to see that we help these children understand and learn in a way that they can understand to equip them for life further. Now, next we have Sheetal, who's coming on, who is our clinical psychologist, come special educator, I should say, actually. And again, with a wealth of experience. And Sheetal is actually our school liaison officer, I should call her, because I think almost all the schools in Mumbai know her and they call her for troubleshooting, at least all the counselors. Now, you would ask me, why are we having a psychologist in the management part of it? Because the role of a psychologist is actually more in the diagnostics rather than in the prognostics or in the remediation. But as we had discussed in the previous session, which was, of course, a long time ago, so you may have to jog your memory a little, is that at times the diagnostics are affected because of certain reasons, and we can see this as a shift once we intervene. So Sheetal is going to walk you through some of those experiences that we have had, and I'll hand over to her now. Sheetal, over to you.
Yes, ma'am. Good evening, everyone. Am I audible?
Yes.
Yeah. Okay. Can I have the first slide up? Yeah. So this is case one, 12-year-old male, state board, referred by school for not paying attention, squirming in the chair, disturbing others during class, and incomplete books. Now, I think this is a scenario where generally, I think all the kids coming to either the school mental health clinic or to the OPD or to the IPD with a similar problem from the school. Next slide. So the assessment that we've done out here is the WISC-3, and that's the Mahindra Bhatt that we have done with him. And so you can see the scores which are there. So on the IQ, you can see the verbal is come 83, the performance is 96, and the full scale IQs come into an 88. Clinically, when evaluated the child, he did not come across like a dull normal IQ because the 88 falls into the dull normal category. The verbal is come 83, which is again in the dull normal category. 96 is average. Now, being a WISC-3, there is a discrepancy between the verbal and the performance, and but it's just at the border. So it's just like a proper 15 points discrepancy between the verbal and the performance. So in such case, we also looked back at the attention being a little problematic, and we thought of intervening there. And so the child was put under for OT. We put in for OT. We also put in for remedial. There was medication started for the kid. And then I would also want to talk about certain things out here when we talk about remediation. I would just share a little bit on the different things that picked up during the assessment. Can I have the next slide? Now, this is basically measles. This is one of the performance tests on the WISC, where they are supposed to do the activity without lifting the pencil, without entering the blind alley. Now, if a child with ADHD is there and they need to finish each maze between a stipulated time, the number of errors are going to be more, and so the errors being more and the scores coming lower is what you're going to look at. Next slide, please. This is coding and symbol search. So basically very similar to what we are looking right now at coding. Now here there are numbers given. There are certain, if you can see, there are certain drawings given out there. So under one, there's a dash with a dot. Two is a curve. So a similar pattern is given for every number. You have to look at the pattern and write it down. You do a practice effect with them, but so the first few couple of the items are the practice items, and then you ideally do the actual test. Again, it is a time test. You can see the number of errors that the child has made, and he's basically fumbled between two similar looking, two similar looking drawings. So this kind of errors you would generally see with children with ADHD because of the impulsivity. They want to just finish and get over with the testing. Next slide. Now, this is a comparison of a pre and a post IQ assessment that we've done with the child. And here again, what I would also want to pick up, what I want to highlight is, now this is post the intervention, obviously with medication, there's been OT and there has been remediation. Now, most of the times we think that, as Alka ma'am very rightly said that, okay, at times when you're talking about management, why management is required to be done, and then how do you understand how much of the shift in the paradigm has happened with the child. So if you can see, I have highlighted certain numbers within the scale scores and in the post assessment, where you can see the information, the comprehension, the arithmetic. The scores have become much better in the verbal area. Even in the performance area, you can see with picture completion coming in a little higher, and even for the mazes. Now, when Simran talks about auditory perception, like she spoke about visual and auditory. So your prerequisite skills when you're talking about auditory perception, visual perception, that's where, those when you are working on them, it helps the child to hear you out clearly. So there are times in a comprehension, sometimes they would ask, okay, can you repeat the question again? Again in arithmetic, you are not supposed to repeat the questions. You have to say the question only once. Again, in similarities, well as very similar sounding words, they would give you answers for a similar word. So a lot of intervention when done auditory and perceptual wise, you would see a shift in the skills that the child would have. So potentially also, as I said earlier, when we had earlier assessed him, we knew that the child was an average IQ. But unfortunately, due to the attention being a problem, he wasn't able to focus. So a pre and a post basically gave us a little idea how the intervention has worked for him when it came into that VAKT model, which Simran has spoken about, where you're looking at the visual, the auditory, the kinesthetic, and the tactile. So a shift from what he was from an 88 IQ coming to an average IQ and clinically matching the picture as a clinician that you want to be wanting to look at. Next slide. Next slide, please. Now, case 2 is basically about a 22-year-old male. He's completed his HSC, diagnosed with dyslexia, dysgraphia, and dyscalculia, having a language barrier with ADHD and trichotillomania. So the child has been on medications. He's been undergoing counseling. He has also undergone remedial for 2 years, and presently he's been taking admission for a vocational training because he's 22, and he's basically come back to us for a reassessment for the UDID card renewal. As all of you all would be aware that the new thing which is there is a UDID card, and post 18 you need to reevaluate the child, and they have to renew the card. So that's how the case has come to us. And because he's an older bachu, we've administered the ways for him because he's an older kid. Can I have the next slide? Now, the ways for India was basically done for him. And here you can see the scale scores. So the scale scores, the average score is between your 8 to 12 is the average scores. All scores which are below 8 are his weakness areas. Above 12 would be the strength areas, and between 8 to 12 is the average score. So most of the scores are following, they are almost in the weaker area. A few are on the strength area. This is the subtest which I've looked into the different tests. And then the next slide, please. And this is what I've looked at, the different indexes that we're looking at. So in a ways, you're looking at the verbal comprehension index. It gives you the verbal comprehension index. It gives you the perceptual reasoning index. It gives you the memory, working memory index, processing speed index, the full scale, and the general ability index. So if you see out here, his scores have ideally fallen down. So it's come like an 89, verbal is come 89, 81. He's coming into somewhere between a dull normal IQ to a borderline. Okay. Now, this child has come to us for assessment. We have earlier evaluated him. So we knew that the IQ is average. But now he's come to us post 18, where we have to do the ways. Obviously, when he was younger, we have administered the WISC on him. But now, because he's older, we've administered the ways form. Now, this child, as I told you earlier in the earlier slide, that is undergone remedial. And mind you, he had a language barrier. But now when you see him, when you assess, like when the evaluation took place with him, he's much better with the usage of language, all thanks to the remedial that has happened, the 2 years of rigorous intervention that was done, and a few of the things which changed for the child. So can I have the next slide up? Yeah, the next slide. Yeah. Now here is the comparison which I've done between the pre and the post. Now, because the child also had a lot of issues regarding his attention, and he's been diagnosed with trichotillomania. He was undergoing therapy and counseling, and so we gave him a little bit time. So because we knew that the score was not that low, the score is a little higher. That's the reason we have done a post counseling, a post assessment for him. So you can see certain areas he has shifted. So his digit span became much better. Matrix reasoning has gone up a little higher. Vocabulary has gone up a little higher. So I've seen a shift from a lower IQ to a higher IQ. So I'm looking from the lower scale scores to a higher scale scores. So where he was not even falling into the average range of the scores, he's now coming into much of the average scores across the subtest. Next slide, please. Now, here if you see, if now I have to look at the IQ, now compared to a verbal of 89 to the post assessment that was done, which has come to an average is 91, his perceptual reasoning became better with an 83 there. The processing improved from a 65 like a mild category. He's come up to like a borderline category. His full scale has gone a little bit up, but obviously his general ability, that's the IQ that we are looking at, from an 83, which is a dull normal IQ, or I would say like a borderline between 70 to 84, 85, we are taking as a dull normal IQ. So now has come up to an 86. So now he falls into the area or the range of IQ that I'm looking at, and then certifying him as LD again. So the interventions were done to see the change, how the intervention works. So whether it was remediation, whether it was counseling, whether it was a medication, how that has helped him to move and become a little better. So post intervention, when I see him today, when I saw him now, the recent evaluation that we have done, he's much better. Like the struggles that he had earlier with language, with expression, and the anxiety which is there has all settled down, and he's much better to perform. So he's really done a good job for him. His IQs come up much better, and we can very clearly go ahead and certify him. Next slide.
Yeah, Sheetal, before you go to case 3, I'm just going to jump in here and
Hanji,
just
ma'am.
let you all know before she goes to that other classical case is, so you have seen now a classical case of ADHD and how the IQ was affected before. And again, someone who had emotional issues, which was basically the trichotillomania, which was treated. And if we go back to our diagnostic algorithms, we had said that whenever in doubt, whenever you have a comorbidity, before giving the diagnosis or getting even the IQ done, it's better to treat, because this may pull down the IQ and it may not be reflective of what is the true ability of the child, since we rely so much on the IQ. So these two cases actually illustrate that to a large extent. Yeah, thank you, Sheetal. You can go ahead with the next one.
Case 3, ma'am. Yeah. So in case 3, again, this is a 9-year-old child, 4th standard, CBSE board, referred for reading, writing, and math concerns from school. No attention or behavioral concerns were reported by the parents to us. So we've gone ahead with the testing. So we've gone ahead with the IQ. Can I have the next slide up? Okay. Now here you see the scores again would range from somewhere, as I told you earlier, the scale scores are ranging from so there are certain areas he's gone into the strength area. There are certain areas which are much lower, and there are some areas which is a little averageish. Clinically, when you, the next slide. Now, out here, what you can see is his verbal comprehension is 85. But when you talk to him, when you are having a conversation and you're holding a conversation with a child, he seems to be more like an average. He doesn't seem to be a little lower. Perceptual reasoning was good. that was 108. So he's good with his, when it comes to drawing, when it comes to painting, doing a little bit of craft work. He loves doing all of that. He can sit hours and sit and do that work. Working memory was a problem where it's come like a 16:9. Processing again was a little slower with him. So the full scale has come to an 84. And we have the general ability index, which is a 95. Now, in this case, an 85 and 109. So the verbal and the perceptual. When I say the VQ and the PQ, according to what we see in the WIST 3. So these two areas, there is a discrepancy between both of them. And obviously, the working memory was an issue. The child also was struggling with English as a language, but not a barrier. I wouldn't say a barrier because he had picked up language, but he was really struggling when it came to reading and to writing. So in his case, what we advised as a team was, let's do the intervention, let's put him under remediation and see, because there were no behavioral concerns from the parent, there were no attention concerns from the school, but he was not able to pick up the learnings that are happening at school. So we said, okay, let's see how we can help him out, but surely we would want to see how he would be doing post then intervention. So he was totally just put on to remediation. So we have just told the parents, we had given a letter to the school that we just want to remediate him. Can I have the next slide up? Now, out here, if you can see, I put in the comparison for the pre and the post scale scores. Now, for similarities, from a 5 to an 8, he's actually gone up. There's been a good enough jump to what he's doing right now. Again, coding was another one, from a 7 to a 10. So here again, perceptual. See, his PQ was good, but within the PQ also, when he has to copy from the board, when he has to look and copy down, or even earlier, as I told you, he has problems with his working memory. So the information that he was holding on, like the sensory memory that we talk about. Okay, so that was a problem. So him to memorize things, write it down. So we saw a shift with the interventions done. So when I would again go back to when Simran talks about saying levels rather than grades, we say levels, because what level was he working? Now, he was ideally in a fourth standard, but the levels that he was working at would almost at the first for the second standard level. But with the interventions, using the VAKT model, we were able to see the shift happening in him, where he became a little more confident. The reading improved for him. We also saw a shift in the comprehension, the language usage. That's how the similarity score has come up, where he was able to express better. The coding score came up because of the eye-hand coordination being there. And obviously, the overall IQ also was a little better. Can I have the next slide? Now, you're also in the IQ. So from an 85, he's gone to a 92. So how the verbal score, has shifted to from an say a dull normal to an average score there. The working memory was, I think, the major change or shift we saw in the working memory from a 69 to an 85. And the general ability index from a 95 shifted up to 101. So with him, especially, I think the interventions that we plan, how it is working. So that's another thing which I would want to highlight out here is the other reason of why we do the assessment post-intervention is to see how the intervention is working. Now, if there is no paradigm shift you're seeing after the intervention done, then you really need to think, are we missing on something else? Okay, now, for example, this child doesn't have attention issues. There were no behavioral issues. Okay, the only issue he had was only the reading, writing, maths. Now, if after doing intervention also, if I'm not seeing a shift in the paradigm, you need to really rethink, okay, is there any other factor which is playing up? Is there any neurological factor? Is there any other issue that is there? So the intervention is also done in a way to see how it is working. How is the child responding? Is he responding? Has he picked up the techniques? Now, for example, like Simran spoke about techniques like Roomra. She spoke about the acronyms PAPAT. So when you are when you're teaching those techniques to the child, is he able to use it in his daily activities when he's sitting and doing his work, and how successfully is he using it? Has he become independent in that? So the other level that generally Simran talks about is the IEP. So making the IEP, you start with, has he achieved it? And then, is he independent? So if he's independent in that technique, you go to the next technique, So in comprehension also, when you're moving from, say, just inferential, you're moving in from just literal comprehension, going on to the inference, and then the critical. So the movement or the paradigm shift only happens once you're seeing that the intervention is done by the right person, done in the right manner. You should surely see the shift. There are times when we have parents who come back and tell us that he's been going for remedial or he's been going for intervention, but nothing is moving. Like, we are not seeing any difference happening in there. So that's another thing, like a takeaway thing, to understand that the remediation done by the right person in the right manner and with a stipulated amount of time will surely show you the shift in the paradigm. So these are certain takeaways that I think as a clinician you can see when you're doing like a pre and a post, assessments. Over to you, ma'am.
Thank you, Sheetal. Thank you. So just using IQ as a tool, it becomes very interesting to see how interventions can actually change and how the reliability on IQ, which is why the latest guidelines actually say that we should have a response to intervention model, but due to resource limitation, we yet rely on IQ. Now, Sheetal and Simran, there are a few questions in the chat box, so let's take them and see how best we can answer that. How to differentiate inadequate training and SLD? Simran, you want to answer that? Then Sheetal can go. Left. Is she still there?
No, I'm very much here, ma'am. Okay. So how to differentiate between SLD and if the
inadequate training,
right? So when students come to us, they normally come with a diagnosis. So we are quite we go according to the diagnosis, and personally, on a personal thing, the child needs help, whether SLD or bad training. While doing remediation, we normally see if the child has got only bad training from outside, the child's pickup is better. There are not many perceptual issues, right? The child is able to use strategies really fast. So these kind of differences we see when we're doing the remediation, and we find out that here the child, the instructions given were not very good. And a student with LD will show you issues with perception, will show you issues with memory, will show you issues with overall, using, even though we do phonetics, the student is not doesn't pick up as easily and as fast as a student who doesn't have these kind of issues. So this is from a remedial perspective.
Thank you, Simran. So I think we have to go back to the basics with this question, because when you evaluate a child, what you see is this is a child who has potential. So when you're orally testing this child and when you're finding different methods to assess a knowledge base, the child has knowledge, but is not able to put it down into curricular context, which is where the specific learning disability is. On the other hand, if you have someone who has inadequate training, you would find that globally there is sort of a deficiency, but you still see that there are splinter areas where there is a proficiency manageable, and that's because of inadequate training. And maybe I'll ask Sheetal to throw a little light on this, because in the IQ often we do get to see this difference between inadequate training and SLD. Sheetal?
Ma'am, there's one thing more that normally, even when we are doing the testing, that's why when we also need to understand the difference, we do RTI with the students. That's response to intervention. We do sessions with the student to understand how he's responding to intervention, and this also helps us to differentiate between SLD versus
yes.
practice. Yeah.
I think I would also like to add in here that when we test a child for learning disability, I think you all do the occupational therapy assessment as well. And I think when you do the occupational therapy assessment, the basic certain skills, the motor planning and all that we evaluate. And that can also help us understand whether, there is inadequate training or a SLD. So I think it's a very comprehensive assessment and it's not based only on a Woodcock-Johnson. So I think that definitely once you do a detailed assessment, I think it's very clear whether it is inadequate training or an SLT.
Sheetal, you want to pitch in? Thank you, Dipti.
I think, ma'am, I would go with what Simran is saying. So whenever we get children with, bad training, as they are saying, or he's not picked up the prerequisites. So the prerequisites the problem, because if the prerequisites are not clear, obviously the child does not move in the next class. So then I think in those cases we generally do an RTI. We try to do response to intervention, and we when Simran said, okay, we would get into say deletion of sound or the substitution of sound to understand whether that basic knowledge even is there or not there. So probably that gives a little more clarity to understand whether it is more of an LD or it is not. So
So, in a nutshell, to tell you all that whenever you have a doubt, what we need to do is work a little longer with the child. You might take a little longer to arrive at the diagnosis, but it'll give you a feel of what we are really dealing with more than anything else. The next question was, is there any method to calculate the degree of disability? I have only answered that saying that we don't really calculate percentage disability. However, the government mandates and the RPWD Act mandates a benchmark disability of 40%. So what we articulate on our certificates and we document is that this is not less than 40% so that the children get the benefit. But globally, we don't really have any system of benchmark disability or percentage disability. The child has the disability, they need help, right? And while we are on the talk of disability, I actually prefer to call it differential ability for that reason, because it's actually the ability of the child and not disability. All right. Next, Vidya says, needs some clarity on SLD certification in kids with borderline IQ. They present in 10th class for the first time and not enough time for remediation. So actually there's a mandate for that. And Sheetal, yes, tell us about diagnosing borderline with.
I think this is one thing that we keep struggling at the clinic, ma'am, because the children come to us at a much later age. We are getting them all in the 9th, 10th. By the time we are getting into the diagnosis in the 10th, because as I said, most of them have language as an issue where they have not picked up the academic skills and things like that. And then we are putting them under for language enrichment program, the LEP, which we generally look into. And obviously is with the borderline. So with borderline cases, what happens is there are multiple factors which are there. So we don't have a case where we have just borderline, just the IQ being low. There could be other reasons like a language barrier could be there. The child could have issues with say some of them have seizures also. So we also get a neurology assessment done for them. We also get an OT done for them, as Dipti ma'am said. We also get an OT evaluation done. So, looking at what are the different, what are the different other variables which are there affecting the IQ overall to come in the borderline. And after that only we certify them that, okay, it's a borderline IQ. Along with that, we also do the informal assessment, which Simran spoke about. So rather than a formal assessment, we do an informal assessment to understand the levels of the child, whether he's at the primary level or the primary level, because it's borderline. 110% will not go into the higher level. It's somewhere between the primary to pre-primary. Most of the times pre-primary, and obviously, the prerequisite skills are the ones which are the most affected. And then only we come to the diagnosis of giving it as a borderline.
So as per the norms that we follow, the guidelines of the RPWD, we are not to give children below 85 IQ a certification of LD, right? So we do not have a proviso to certify borderline with LD yet. We have not reached that level, right? So as of now in our country, you need to have a cutoff score of 85 in order for us to certify SLD. And if it is borderline, then you certify borderline, and depending on the various state boards, they may get provisions or not. This year, the ICSE has included provisions for borderline children, and so has CBSE. So I'm assuming that a lot of state boards will follow soon. And I'm going to take the next two questions, after which I'll ask Dipti to ask a few questions. Is there any duration for remediation classes? And if so, how many sessions? Simran?
So yeah, since remediation is a very child-centric process, it all depends on how the child is taking things in. So, to give you perfectly, yeah, okay, it takes X amount of time. I would not be able to say that, but in whatever experience I have, 1 year, 2 years, there have been students who've been with us for 3 years also. Right? So it's not that it's like fatak se wo remediation kiya to 6 mahine mein you will be able to see any kind of differences. No, we are working with neural pathways, right? So through activities. So that would take time. Also we have conditions like students don't come, exam time hota hai, they don't come, festival time hota hai, they don't come, right? So this also then elongates the process of remediation. So there are a lot of factors that go into the amount of time that remediation would take. And like I said, mainly it is child-centric. Some students pick up faster, some students pick up slower, even if they are like doing things on time. So, yeah.
I would want to add to this, Simran. So even if the IQ is at 120 or a 110 or a 130, okay, it's not that because the IQ is 130, you will pick it up.
Correct.
The remediation will happen quickly. No, it doesn't happen. I have a lot of parents who say, "Itna हुशार है, 120, 130 IQ, madam, इसको इतना time लग रहा है." So what Simran is trying to say is, irrespective of the IQ, the skills that are the prerequisite skills that he needs for reading, writing, maths, it's again, you're working with the neural pathways. Now, how easily can he connect? Or as again, here I would want to also talk about the earlier question where they said, bad training. Now, for me to change that training, to introduce the new techniques, the neural pathways, it will take time. So it doesn't have to do anything with the IQ. Let me make it very clear. The IQ and the remediation does not go together. It is irrespective of the IQ. It depends on the child himself and the different modes that you're using for intervention. So the more you use the VAKT model, the better you will see the improvement in the child. So yeah.
Also the comorbidities that are there. Agar ADHD hai and the child is not taking medications properly or is not having, not going for OT regularly and stuff, that also affects the time for remediation then. Like has a language barrier. So, then you find that the child, even if it is secondary, he's at a 8th standard or 9th standard, but working at a pre-primary level because language barrier has also helped, has also pulled his levels down. So वो सब affect करता है, and hence, to give you sure shot, it takes X amount of time is not really possible.
So I often give examples to parents likening remediation to a sport. For example, if you learn swimming, you're not going to learn it overnight. And even if you learn it, it's not like you can't learn better. So you keep honing your skills and getting better and better the more you practice and the more number of sessions that you have. So remediation will take years, and it's important to tell parents that it's not going to happen in just a few sessions. It's not a module of 6 to 12 sessions or 6 months or this thing. It's one is that it's very individualized. It depends on so many things as far as the child is concerned. And second thing is, there is nothing like a short remediation or long remediation. The more you do it, the more skills your child is going to pick up and the better it's going to be for them. And maybe Dipti can add to that if she has anything to say.
No, I think I agree with whatever you all have been saying. Especially in private practice, it also comes to the cost factor, and because of which we see a lot of this happening. So we do try that, after doing a few months of remediation, if we feel that the child has picked up the basic skills, then we try and intervene with the tuition teacher, which is the norm these days, help out the tuition teacher a little bit so that the parents are able to afford fewer remediation sessions, and then, train the tuition teacher or the parent to help with a few skills. So that's what we try to do in private practice.
Yeah, that's a wonderful point. The next question is, are we still following the VQ-PQ difference to diagnose LD? Sheetal, you want to take that? Yes.
No,
No,
it's
a
not
valid
about
question.
it's not about that you're following the same thing with the VQ-PQ. You need to look at the overall score. So now with the WISC-4, and the WAIS-4 that is right now being used, there are different areas we are looking at. You're looking at the VCI, the PRI, the WMI, the PSI, and the GI. So most of the times we look at the
Tell
GI
them the
because
full form. Many of them don't know the full form. So tell them the
so
full form.
verbal comprehension index, the VCI is the verbal comprehension index, the PRI is the perceptual reasoning index, the WMI is the working memory index, the PSI the processing speed index, FSI is the full scale IQ, and the GI is the general ability index. Now, the general ability index is made up of your VCI and the PRI together. Most of the times what you will see is the cognitive processing index, which is your WMI and the PSI, would be lower in children with LD because they take time to process. But the VCI and the PRI, now again, VCI is more of the acquired knowledge, whereas the PRI is basically the innate ability. So most of the time, if the child has a problem in expressing, the VCI is going to be lower. Secondly, the language that he is using. So we are not looking, so I'm not saying that we are looking at the discrepancy. You need to look at like an overall score. Secondly, with the WISC-4 and the WAIS-4, which is there, if you're are well versed with this, there is a statistical discrepancy model which is there. So you come to know how one subtest is, whether it is statistically significant at that level of the score between the subtests. But as I said, in general, we look at the whole IQ together. But yes, we look more at the GI because it constitutes of the VCI and the PRI. Secondly, to give the benefit of the doubt to the child. Not so. For example, like my earlier case where I had that 83 and a 96, okay, and the full scale was coming much lower. Now I can't take a full scale of say a 83 or something, wherein the PQ is 96. So to give the benefit of the doubt to the child, you need to look at all the scores and keep into consideration the kind of errors that he also makes. Now, it's not just IQ. You're going to look at IQ as well as the educational assessment together. So I generally look at the GI. So for me, the GI is the score that I would look at rather than a discrepancy. And what is the reason for the discrepancy? Is it inattention? Is it language? Or the ADHD, which is just playing up. So you need to understand the discrepancy is happening because of what. And then the intervention to be done, and then you reevaluate the child. That's what I think Alka ma'am is trying to say, that why we are doing like a pre and a post. And then you intervene and then you assess the child again.
So we don't use the WISC-3 anymore, which had the differences between the the verbal and the performance. The WISC-4 is more comprehensive and it gives more of a global index, which is what the GAI really is, right? Okay, over to you, Dipti, for the next few questions.
Yeah, I think the next question has already been answered. What is the difference between general ability index and the global scale IQ? The next one is, at which age certificate of LD is valid permanently? 18 years, or for frequent certificate, the patient has to visit the doctor or psychologist. So basically, by what is the age criteria and when do they have to visit for recertification?
So it used to be 10 years, 14 years, and 18 years. That has changed now with the latest Gazette notification. So once you certify the child, they next have to come to you at the age of 18 when they get a permanent UDID, which is the unique disability ID mandated by the government of India. And after that, you do not have to certify them again. So 18 is and that has become a must now for most educational institutes for admission, for provisions, so on and so forth, even higher educational institutes.
Yeah, thanks, Alka. There's another question. I don't know how it is relevant to this session, but Dr. Alka, do you get simple partial seizure kids? How common is it?
We do get, I don't think I'd be able to give you a prevalence of our population. We do get children with comorbid seizures, but like Sheetal said, very often then they do not fall in the LD category because they have a global developmental delay or a developmental lag, and they come in the lower IQ ranges. Also, at this point, it's important to understand that anti-epileptic medication does have an impact on cognition and performance. So it does cause a little bit of dulling, which we do see. So, immediately post seizure, we do not do the testing. If they have had multiple seizures or if there's a change of the medication and the drug is stabilizing, we do not do testing, those kind of things.
Yeah, thanks. I think next question, I think two questions are similar. At what duration we need to reassess the child for improvement once the child is diagnosed with SLD? So I think the pre and post that we are talking, they're asking what is the duration between them. There are two questions similar to that.
So assessment, once you've started remediation, how often, means after how long should we reassess to see that your intervention is working?
I think Sheetal wants to answer that.
Well,
Simran?
generally, yeah, I think Simran can answer that one.
So generally we normally ask at least after a year, right? It's only on very special occasions that we say 6 to 8 months. Otherwise, minimum a year, 1 year of intervention. So it's necessary on regular. It's not that the child is then not coming. So the child has to go regularly for his remedial classes. So minimum a year.
Thank you, Simran. I don't. So the next question is, if the full-scale IQ falls in borderline range, even after remedial and behavioral interventions, for UDID purpose, should we include and mention both the disabilities, ID 25% and SLD 40% to calculate the multiple disability, or only SLD? Alka, I think you said that borderline anyways, we cannot diagnose as SLD, but maybe you can answer this again. I think
the
Alka's screen
connection.
seems to be frozen.
Connection.
Sheetal, you want to take that?
So, ma'am, as Alka ma'am has already said earlier, that because it is borderline, the moment we say borderline, and as with the new gadget which is there, it's like a 70 to 84. So all the IQs between the 70 to 84 are in the 25% of the 25% disability. Now, for any child to get diagnosed with LD, the IQ has to be above 85. Now, with that also, not only IQ, let me again put this across to the people who are listening. It's not just the IQ, it is IQ along with the educational assessment done. You have to look at both the evaluations together and take a call where you're looking at specific, analysis, the error analysis that we look into. So there are error analysis, which I think Simran can talk about. And you're looking at what kind of error analysis you're seeing in the protocols that you're getting of the child when you're doing the education evaluation. Okay, which would again not match with the error analysis of a child with a lower IQ. That's one way you're going to differentiate. Secondly, as I told you, why the IQ is low. Is there any other comorbidity? Does the child have epilepsy? Does the child have any other issues? Any developmental delays? Any hearing impairment? So if there is, say, the child has low IQ along with a hearing impairment or a seizure disorder, then those two you can club together. But a child having an IQ of 85 only does not qualify for LD. You can start the LD, you can do the assessment, but you have to look at the error analysis and then only certify the child with an IQ of 85 to be LD.
Thank you, Sheetal. The next question is, I see remediation happening without any plans being shared with parents. Is that okay? Also, does this mean they work on class curriculum or at current functioning level? And how is the gap bridged? I think Simran would like to answer that.
Yeah. So no parents, as in we need to discuss the IEPs with the parents because we do take into consideration what the parent, some of the parents want, okay, he's like you've talked about certain part of the curriculum, right? He's weak in SST or he's weak somewhere. So I'm not saying that you take the curriculum, but we introduce study skills and stuff then to the students, okay, okay, you want him to, you want to help him learn XYZ things in SST. Okay, let's work with the study skill for it, like Dipti ma'am had mentioned, working with the tuition teacher also at that point of time. Okay, he's weak in this. Why don't you try this method of teaching him or this method of doing this, this part? It will help him. It's helping him in remediation. It's going to help him there also. Right. So yes, discussing plans with parents needs to be done. The parent has the full right to see the IEP. On class curriculum and current functioning levels, we work with current functioning levels, right? Wherever we feel, during exam times, now we have to, it's real, we have to work with that in our minds also, right? The child is going to be, he's in standard 6, maybe working at a, pre-primary or first standard level, but he has to give an exam also, right? So we do then take parts of the curriculum, but water it down and use it, with our techniques. So I can take a part of SST, for example, and use my comprehension strategy to help him to comprehend those paragraphs, right? So that way we try and bridge the gap between the bridge the gaps also. But yeah, parents need to be, can be, as an IEP can be shown to the parents.
I think it is team effort. Yeah, Alka wants to add.
No, I got thrown out, so I don't know where we lost. But someone had asked whether we can give borderline and SLD together. You can't diagnose SLD if borderline is there. Please,
Yes.
let's be very, very clear. You need an IQ of 85. Never do we give multiple disabilities for borderline with SLD. That's a big no-no.
Yes, I think that clarity is needed. There are quite a few questions which are, kind of centering around the same topic of borderline IQ or mild ID.
I understand that we struggle a lot with borderlines because we don't have guidelines for it. We do not have any provisions, and the parents are very distressed. And well, there's a lot of effort being made by the education board to see that the curriculum is not, because see, what is borderline IQ? Borderline is basically someone who has a less than average IQ. So what they need is a different curriculum which will adapt to a skill set. So that's why, again, not a disability, it's a differential ability. So what we need to do is provide them with vocational skills, and by vocational we mean training in specific occupations by which they can flourish, which our curriculum does not currently offer, which the new NEP is supposed to offer. So we have to wait, and hopefully change will happen.
Right. And I think sometimes NIOS does the trick for these students. But yes, that again is very
there's lots
parent-centric NIOS rather than being in education, the institution-centric. So that again is a challenge. Okay, I think, could you please clarify the challenges in mild intellectual disability with LD? So again, I think that same confusion that mild intellectual disability students cannot be certified as LD. So that is something that I think our audience needs to again understand. Do you have a psychiatric social worker in your team? That's what they're asking.
We have a psychiatric social worker as part of the department, and whenever needed, we do refer all cases to them. They are not always doing the counseling for the parents, because the counseling is done more by the psychologists, the special educators, as well as we have child fellows, child and adolescent fellows, and the psychiatrists themselves, because there are so many questions like this which even the parents have to answer. So yeah, the social worker usually gets involved whenever there are financial issues or there's a community issue, we need to reach out. So then we do involve them.
Thank you. Are there any conferences being conducted on SLD among adolescents or young adults? And can you let me know about it?
For adolescents or young adults, you mean?
Yeah, I think that's what they mean.
So there are support groups. That's a very interesting perspective. Conferences are conducted usually for skill development of resource personnel like all of us. And Thursday Musings is one of the resources that people use to develop their skill sets, but not for the children. They have more of support groups which they kind of reach out to. What we do at our hospital, however, is we have a pre-10th board. These all of them conduct a seminar for 10th standard kids on how to go about the 10th grade and how to manage their study skills. And in that, what we do is we call other children who have been previously diagnosed with SLD to sort of be motivators and mentors. So if that helps, and that's something that all of y'all can really start as a sort of a group, a collective group at your various centers.
Yeah, I think that's an amazing idea, which we can work with. What about a child with ODD and SLD? If they don't cooperate with the assessment, how do we proceed in such a child?
With lots of patience and lots of trials. Yeah, well, Sheetal and Simran have had lots of experiences. Do you want to share? They give breaks, they call again. Yes, go ahead. Defiant children who have attacked you, shouted at you, so on and so forth.
Yeah. So here I just want to bring it up. So when it comes to assessments, like even with my ADHDs and my kids, who are a little stubborn kind of a thing, what happens is it's not that they're not okay with coming for assessment. They're absolutely okay with coming for assessment. There are times when they don't understand why why they've been, bought for assessments. Like why do the parents send them for assessment? Because they don't feel there are issues, like they don't feel there's something wrong with them. So in my sessions, there have been times when when the child would say, I don't think I have an issue. I don't need any help. Okay. Sometimes the child and a little understanding, especially the older kids, the defiance with the older kids. You can actually sit across, talk to them, you can involve the schools. In a few of my cases where I've involved school had a word with the child before sending them for testing, and evaluation. As the parent, also known the whole evaluation procedures, because we have a pre and a post counseling session that we've been having. So something like that works with are much more receptive than when they are doing the evaluation. So this is how I have gone around when I come across cases like this. Simran, in case she wants to add up anything to this.
I think, Sheetal, you've covered most of it. That we give breaks. Yes, we do give breaks. And if in case we need to call the child another day, if he's very defiant and just doesn't want to do the testing, we go ahead with giving another date. And counseling, like Sheetal said, extremely important in such cases also. So, yeah.
Yeah, in fact, I have had cases where after getting the certificate, the child refuses to submit it to the school because they will be categorized as special children or, counseling children, and the questions they ask is, will I be made to sit in another room to write my exam? And then other kids are going to make fun of me. So I think, yeah, these are all challenges which we have to navigate through with patience and with counseling the child and the parents, and many a times the school authorities as well.
And also to write a letter to the school authority. See, this
Yes.
child is, however much difficult it is to navigate with this child is not really someone who is volitionally doing this, right? So till the medication, the therapy and everything works around, we should really liaison with the school and write to them that this is what we have done, this is the intervention, please bear with the child. The child must be having problems in school too, don't throw them out, don't penalize them, so on and so forth. And coming from a medical professional, it makes a world of a difference. When you write a letter to the school saying that the child has confessed to you about bullying, they intervene. The child may have told the school, the parents may have told the school dozens of times before that, the impact is different. So please go that little step forward, go a bit of an inch that you have to go more and make that effort.
Yes, very much. So I think Ms. Vidya says, thank you for this valuable session. Please conduct more Thursday musing sessions on CAP with Alka ma'am.
Oh, sorry. Thank you.
Yeah, we are hearing that. We have noted that.
Now, we did what was promised, Alim. So,
Which
So
tool can be used for SLD? Yeah, sorry.
No, ma'am, please carry on.
Yeah.
Please carry
Which
on.
tool can be used for SLD assessment above 14 years of age? Sheetal?
And there are tools you can use for assessment because you got the Woodcock, which is there. You have the CBT, the curriculum based test, which is there. You have the CBT, which is there. The CBT there, the RAT there. RAT 4, you have the RAT 5, which is there. So there are a lot of assessments which are available in the market when you look at the number of assessments to be done. You have the TOWEL, which is specifically for reading. You have the CTOP, which is specifically for phonetics. So there are a number of assessments which are available, and every center across the city uses a combination of battery. They do like a battery of assessment with a different combination to come or to arrive at a diagnosis. Yeah, there's no one particular test that is being used.
so also mandated by the Act, you can mention, Sheetal, is the NIMHANS battery and the GLAD, which is what you can try. They all have their, everything has its limitations. We do not have a clear-cut indigenous India-based test which we can do. So to be very honest, it's an eclectic mix.
I think again, patient above 18 years asking for disability certificate but low IQ, can we give not previously diagnosed? So I think again you will have to probably give a disability certificate for low IQ and not a specific learning disability. Any relaxation for students in college for exams like there is in 12th board exam? Any guideline from UGC or government body?
So you're talking about professional colleges. Professional colleges usually give extra time, and now. So recently, just as of yesterday, we got a notification from IIT where they want us to assist them in helping these children, whether they need a scribe or assistive devices. But more than that, usually there is no, see, when you go to a professional college, there's no question of dropping out a subject or not doing XYZ because it's a profession. You have to develop that skill set. So what is the maximum that a person can give in terms of provisions? That's extra time. And you could have either a writer or an assistive device. More children opt for the assistive device because then they are independent and they manage quite all right.
Yes. Role of psychiatrist only for disability or remediation? So I think only for disability certification or remediation.
We are a team. Do you think that any of us would have been able to do it without both of them here? No, that's why they're here, because they're the experts in the field. So we work knowing our various skill sets. I don't think I would do remediation. I'm not sure about Dipti, but I doubt she would do. But we do know aspects of remediation to understand it so that we can see what improvement the child is having, right? That's why it's important. It's like learning psychological testing. We know psychological testing, but do we administer psychological tests on the child? We don't. So to enhance our own skill set to help explain to our patients, yes, it's very important. Just like both Simran and Sheetal will be able to diagnose ADHD. They are easily able to diagnose if a child has anxiety, depression. But do they diagnose and treat? No, they don't. So it's something similar.
Yes, and I think we also will help treat the comorbidities and we will be able to help parents understand the child better. So I think, yeah, it's totally a team effort, but we will not be able to do remediation as psychiatrists. A lot of limitations for that. Any books or manuals for individual remedial technique methods for us to refer and learn more? Purpose and parent training purpose, ma'am.
Yeah, books are available in the market for remediation. You could look up. I think there are quite a few books. I'm not getting the names of the books right now, but books are available for remediation. But that again, for example, it's good to understand that but obviously a special educator would be going ahead and doing the remediation. But if you want extra knowledge and want to understand more about this, books are available.
And I think there are a lot of systems like the ABC system, Sonde system, which
Yeah.
are also available. So there is a lot of material out there, but I think as Simran said, it's important that a professional uses it with individualized approach for the child specifically. Not everything is going to fit every child. So I think we need to understand that, and that's why having the help of a professional is going to be very important.
Dipti, I would just like to add, there's this one book called Learning Difficulties. It's a book by Unita Nakra, and I think it was one of its kind when I did my courses and everything, you know. So it's by Unita Nakra. It's called Learning Difficulties, and it's a very simple book, a basic level book where you can understand, so especially on the lines of prerequisite skills, you know. So I can think about that one book which has been there. So it's called Learning Difficulties by Unita Nakra. So yeah, I think it's available where if anyone wants to go through it.
Okay, it's already 10:15. Alim, Tufan Pati sir, are we supposed to just? I I don't know. There are a lot of
I think we can wind up now.
We
Our
can wind up
speakers
now,
have
but
been-
if you are interested and the audience is interested, there's no. But it's quite long.
Up to you guys. Yeah.
You have been exhausted, all of you, all the faculties.
yes. I'm just putting in my email ID there, and in case you have queries, you can always reach out to us.
And that shows that chapter is not yet closed. The
Yeah, so
questions are
we have an Indian book on SLD where all
Yeah.
of them are contributors, and you can always refer to that, and that quite comprehensively will answer all your questions. Unfortunately, I did not carry my copy, but yes, that will cover it all. It's called
If there is any link to buy, you can post it here.
Ma'am, I think I have the book.
Amazon. You have it here, please.
So you can post in the chat box. So if people want to, they can access it.
Your pick. Okay, so it's available on Amazon. It's called Specific Learning Disorders: The Indian Scenario. So you can always
So
refer.
I think we should start winding up now, ma'am.
Yes, please.
Yeah. So to the chairpersons for the final comments. Yeah.
There, Sheetal is showing it to you, and this is available on Amazon.
Yeah. I have it.
Thank
I think you only gave it to me. Yeah. So Deepti ma'am, any final comments from you?
I think this was a wonderful session. Both our speakers were wonderful. And as Alka said, that we have understood that remediation is very intensive. It is very effortful. I think as professionals, as psychiatrists, we should not end at diagnosing. We should not end at certification, but we should look at interventions. We need to be the catalyst to nudge the parents to carry on the interventions, because otherwise parents are happy with a certificate and they don't help the child further. So I think that's very important. So this webinar today has helped us understand that. And thank you very much, both Sheetal and Simran, for that wonderful talk. And I think I can now tell Alka to give her closing comments.
I'm just very grateful that we had almost, I think, 200 people over here trying to understand what remediation was about. Only Thursday Musings can help us reach out to so many people, and that there are so many questions. That means there's a lot of understanding amongst our fraternity itself that is yet required, and I hope we can help create advocacy and awareness more. So thank you for having us here. And it's wonderful to co-chair with Dipti, who's a dear, dear friend.
Thank you, ma'am, Dr. Deepti, Sheetal ji, Simran ji. I think the number of questions still unanswered. If we can have some sort of live demo thing, what actually is being done in the clinic, so we can take it a step further. So any recorded videos, if is there, those sort of things. So just giving an idea to you, ma'am. So over to Tufan sir for the final comments and Thanksgiving and ending the session. Sir, over to you. You have to end the session.
I profusely thank all the 4 faculties, both the chairpersons and the speakers. The contributions of everyone was immense. And truly this process is exhaustive process as this session. And I was Googling the persons available in India with our special educators. The number is very low in comparison to the need of the country.
It is.
The mathematical equation comes, and the places where it is available, that is still dearer. Mathematical conclusion is that many people are not able to access this service, even if they want to. And the second problem is attitude of the parents. As Dr. Dipti was telling, that certificate we got and it is okay. No further effort for the child. Because we have got other children to see. My job is there. So that needs a address. And maybe we should be having more efforts, and we must sensitize more and more of psychiatrists and other mental health professionals. And we'll be having another session definitely on this, and we'll having a bigger reach out, because today there is SIPCON and Alim belongs to SIPCON. Still is here. Thanks all the speakers, all the moderators, all the attendees, and Tarrant at last. It's an exhaustive but interesting session, enlightening, enriching. But the problems are there. You have to increase the services somehow. Sensitize this comment and everyone, schools, that is required. Thanks everybody. A good night.
Thank you, sir. Thank you, everyone. Thank you. Wonderful session. Wonderful session.
Good night.
Good night, everyone.
Good night. Good night. Thank you so much.